This is the, you might call it the quiet before the storm, right? I was just commenting that it was really nice to see trees being trimmed along the power lines as I drove down here today, all throughout Bristol. So I'm not sure how that's happening, Mayor, but my wife was saying to me, wow, it's really inconvenient to wait to get around these. I said, stop, it's okay. This is really like the best time to have those trees trimmed. So folks, I'm Kurt Barwis, the President and CEO of Bristol Health, and I am super, super excited to welcome Governor Ned Lamont and Acting Commissioner Dr. Gifford to Bristol Health, and to join them today for a conversation about the importance of receiving the COVID-19 vaccine. I'd also like to welcome some distinguished guests here today, Mayor Ellen Zappo-Sassu, Marco Palermo, who is here in the back, thank you. He is the Director of Health at the Bristol Burlington Health District, and he's been like just the most incredible partner along with the city and us in fighting this pandemic. And our legislative representatives today, and I see Representative Whit Betts, and I'm looking around the room, and I see Senator Henry Martin, and hopefully I'm not missing anybody, but it is always welcome and a pleasure to have you here today. Since day one of this pandemic, and I do remember a press conference here back in March, I remember, I'm not sure we were wearing masks that day actually, but it was the kickoff, and I recall the governor commenting about the fact that Bristol Health itself was started on the Spanish flu pandemic almost exactly 100 years ago. It's December, it'll be 100 years for us, and we were commenting about making it through another major pandemic, and I had seen pictures of Muzzy Field and people actually spread out with masks on, dating back to 1919, watching baseball games with masks on. It was quite remarkable, and we're now actually collecting pictures of the history of this hospital for a 100-year anniversary, so I'm sure we'll see some of those. So we along with hospitals across the state have worked tirelessly to protect our residents, patients, and staff from being one of the first hospitals in the state to set up a COVID-19 testing station to now vaccinating as many people in our community as possible. To date, we've administered more than 25,000 vaccines. But folks, we have a lot more to go, right? That's what today is all about. And our numbers of COVID-positive patients have gone way, way down. So obviously, these vaccines work, right? Okay, that's the key. And it's largely because people are getting vaccinated, but we have, like I said, a ways to go. The success would not have been possible without our strong partnership with the city, as I mentioned, the Bristol Burlington Health District, and organizations like the NAACP, which have helped us reach many older, frail, homebound patients and administer vaccines on a larger scale at our mass vaccination site at ESPN, an amazing partner for us. And this level of success would also not have been possible without the support of our governor and the Department of Public Health. And you know, I can't say enough about that partnership from day one. And I commented as we were walking down here to the team, it's like the day that never ended. I'm not sure how you all survived it. I'm not sure that any of you signed up for what you did, but to all of you, we are just forever grateful and appreciative of what you've done. You know, and the vaccines are, you know, in terms of us and all this support we've got, I'm here to say these vaccines are safe and effective, have been truly a life-saving turning point in our fight against this pandemic. And again, there's just tons of work to still be done here in our community and across the state. I'd like to introduce Commissioner Gifford. They are both here today, by the way, to talk about vaccinations, as I said, and share innovative ways for our state to encourage people to get vaccinated. So without further ado, Commissioner Gifford.
Thank you, Kurt, very much for having us here today. Delighted to be with you. Good afternoon, Governor and Mayor. Thank you for hosting us this afternoon. Director Palermo, thank you very much for your hard work over the course of the pandemic. Representative Whit Betts and Senator Martin, thank you for joining us. A couple things today that we'd like to update you on the status of our vaccination program. First of all, some very, very good news, and if you could tee up the first slide. And then the not so good news about where we are on our vaccine program, and then what is left to do and where we're going. So here's the good news on this slide. If you look at the middle row, you can see that in Connecticut, we are now at 79.6% of all adults in the state of Connecticut who have received an initial dose of vaccination. So probably one of the questions that the governor and I have received most over the course of the last year is, when are we going to reach this thing called herd immunity, and what is that magic number? And of course, we've always answered, well, there is no magic number, but most people say you want to get to about 80%. So when it comes to our adult population, we're getting very close in Connecticut, and that's due to the hard work of our partners in the community, our providers all over the state of Connecticut. It's due to so many community organizations, local health departments, federally qualified health centers, pharmacies, community-based organizations, advocates, on, the people who have really gotten together and gotten us to this terrific milestone. So that's great news, and we continue to be, as we have been throughout this vaccine program, one of the states with the highest level of vaccination among our population in the country. So we're very proud of that, very proud of the partners, and very grateful for all of the work that's been done. And it's really due to the people of Connecticut who have, all throughout this pandemic, worked right alongside the governor and myself with masks, with the reopening, with the closing, with schools, with contact tracing. So a very commendable milestone and achievement for the state. If you can go to the next slide. So we still have a little bit of work to do, and that's another thing that the governor and I want to talk about today. There are pockets in the state, as you can see on this map, where our vaccine rate is not quite the same. It's lower than what it is elsewhere in the state. So you can see Eastern Connecticut, we still have some work to do to make sure that people have all their questions answered, that they have adequate access to the vaccine, that they understand the importance of getting vaccinated. And then some of our largest cities and towns, we're still working to make sure that they have the vaccine rate that looks like the rest of the state. So you can see Bridgeport, New Britain, Hartford. Now, those are in some ways also younger cities, so you have to keep that in mind. There are more children in some of these larger cities who aren't yet eligible for vaccination, so that's part of the explanation for why they have lower rates. But also, we're hearing and continue to hear that there's some hesitancy, and that's one of the things that I want to address today. So it's important, just to put a finer point on something that Kurt said, that we don't have pockets of low vaccination rate in Connecticut. We really want to eliminate any pockets of low vaccination, and that's because we are seeing around the world and elsewhere in the United States that the Delta variant is becoming the predominant variant. It's not predominant yet in Connecticut, due in large part to our high vaccination rate, but it could become dominant in these pockets of under-vaccinated people. We know it's more transmissible, and we know it's probably causes more severe disease. So we want to make sure that we don't have any areas that are vulnerable to a return of COVID in the fall. So July, August, September is really our opportunity to get to these last pockets and make sure that people have all their questions answered, they know the facts, they know the truth. We can bust some of those myths, and people know where they can get vaccinated. If you could go to the next slide. This just shows you where we are doing our vaccinations now in Connecticut. So the blue bars are pharmacies. The orange is local health departments. The gray are our federally qualified health center partners. The yellow is hospitals, and the blue is others, including private doctors' offices. So you can see that back at the beginning of the vaccine program, or early in the program back in March, pharmacies played a smaller role. Local health departments and hospitals and FQHCs played a larger role. And as time has gone on, the pharmacies have become more and more important parts of our vaccine program here in Connecticut, and the other partners are doing less vaccination. So this is more the norm, and it's the good news there is that we have over 300 sites around the state of Connecticut where people can get vaccinated. So these are convenient sites. They're in people's neighborhoods. We're not only in the large chain pharmacies, but also in grocery stores, in Walmart, and virtually all of the chain pharmacies that also are administering vaccine. So now it's time to finish the job. So what are some of the things that we're doing? If you could go to the next slide. We understand, and I want to speak directly to people who are still on the fence about getting their vaccination, and maybe address some of the things that we're hearing are causes for concern. First of all, we hear the vaccine was developed too quickly, and therefore you're not really sure about the safety of the vaccine. So it is in fact true that these vaccines were brought to market more quickly. They are authorized under what's called an emergency use authorization. But there were not shortcuts done in the science. There were large numbers of people tested before the vaccines were approved for emergency use. And of course, there have been hundreds of millions of people vaccinated since they've been approved, and the safety has been demonstrated. There are risks to the vaccines. We know there are risks of minor side effects like a sore arm or a low fever or fatigue, which I had after my vaccine and most people did. And we know that there are very small risks of more serious side effects, and those have been in the news. Rare blood clots with the J&J vaccine, allergic reactions, and some short-term and usually not serious heart side effects with the other vaccines. But we also know, and this has been stated by the FDA and by the CDC, that the risk of getting COVID is much greater than the risks of some of these even more serious side effects. So yes, there are minor side effects to the vaccine. Yes, there are rare and serious side effects to the vaccine, but they are outweighed by the known and much more common risk of getting COVID. We are seeing in people that are hospitalized in Connecticut that the vast, vast majority are unvaccinated people. So if you're unvaccinated in Connecticut, you're the ones that are at risk of being hospitalized. I'm sure that's the case here in Bristol. Virtually all of the deaths, not all, but very close to all of the deaths we're seeing are in people who are unvaccinated. So the risk of getting COVID, getting hospitalized from COVID, or dying from COVID remains if you're unvaccinated. So keep that in mind when you're weighing the risks of the vaccine and the risks of getting COVID. Another myth we hear is that the vaccines cause infertility and problems with reproductive health. And this is impacting a lot of young women, many of them in healthcare, who are thinking about getting the vaccine. I was trained as an obstetrician gynecologist. I don't practice anymore. But of course, this was a very important question for me to make sure I understood. And I just want to say to those of you who are young women and are concerned about the risk of the vaccine on your ability to get pregnant, there is no evidence whatsoever that the COVID vaccine causes any problem with infertility. So, in fact, if you're thinking of getting pregnant, it's probably a really good idea to get the COVID vaccine, because we know that women who are pregnant are at risk for more severe COVID disease when if they were to get sick when they were pregnant. So, when it comes to infertility, no evidence whatsoever that the COVID vaccine causes any problems with reproductive health. And finally, there's just the issue of trust. Particularly in certain populations who have felt that the healthcare system, the public health system, and government in general has not been fair to them, that there have been issues of systemic racism, that we haven't adequately addressed the needs of certain populations. We understand, appreciate, and recognize those concerns. So what I would say to you, if you're a person of color who doesn't necessarily have confidence in what you're hearing from public health officials, talk to a member of your community that's been vaccinated and see what they have to say about their reasons and rationale for getting vaccinated. We are working very hard at the Department of Public Health with our community partners to make sure that we're working with members of the community to get out the word and spread the news about the safety and effectiveness of the vaccine. So understand and appreciate those issues of trust, but talk to somebody that you do trust to get the information that you need about getting vaccinated. So now to the fun stuff. In addition to getting out information about, the truth about some of these myths, we also are doing what we can to make it a little bit fun to get a vaccine. And our Rock the Shot and Summer on Us initiatives at the Department of Public Health are part of that. So today we are announcing the first winners of our Rock the Shot campaign. These are individuals, they're on the slides here, who have won either 2 great tickets, premium tickets to the Jonas Brothers, or 2 tickets to Luke Bryan, both of these at Xfinity. And they will be contacted by the Department of Public Health. Those people listed here have given us permission to share their names. We're not using their last names nonetheless, but you can see that they're from all around the state. We're delighted. We had over 3,000 people enter the first Rock the Shot contest. And we'll be making one of these announcements. I don't know if the governor will be making it every single week, but every Thursday we'll be announcing the winners of the Rock the Shot concert tickets. In addition to that, you can get free tickets by going to certain clinics that are giving away concert tickets to the first 24 individuals to get vaccinated. So it's a great deal. Show up to get your vaccine. If you're among the first 24 people, you get a pair of tickets to a wide array of concerts. We've been working with Live Nation to get these tickets for concerts that are happening all throughout the summer. So you can go to ct.gov/rocktheshot if you want to enter. It's not too late. Please go and enter. Please get vaccinated and then enter if you're not already vaccinated. If you got vaccinated before, you can still enter. You don't have to get vaccinated in the next week or two, but we hope you will. And then go on to ct.gov/rocktheshot. You can find out where the clinics are being held, where you can get free tickets, and you can also enter for next week's drawing. So with that, I am going to pass it over to Governor Lamont, who's going to talk a little bit more about incentives and also has a special guest. Governor.
All right, thanks, Deirdre. I was just listening. Maybe you're sort of wondering, hey, Connecticut's doing really well. We're done with this pandemic. Why do we have to keep talking about vaccines? 80% of us almost of adults have been vaccinated, pretty darn good. Maybe a few more have had, were infected previously, so they built up some antibodies. Let's go party. And but I think if you saw from the charts that I was looking at from Deirdre, the numbers don't always tell the full story. Look, it's absolutely true. The number 1 most vaccinated town in the state of Connecticut was Canaan. I just saw it. 99%. Canaan. Let's hear it for Canaan. Followed closely by Salisbury. And the most vaccinated demographic out there are folks over the age of 65. 95% vaccinated. Henry, you and I can go party in Canaan and probably have a pretty good time. But that's not the whole story. I think you saw from Deirdre that we've got communities in our state that have less than half the people are vaccinated. And she mentioned the big cities, but I also saw Sterling and Mansfield and some of the smaller towns as well. And you see that around the country. We're a United States of America. We're more likely to be vaccinated than just about any country in the world. And yet we have about a third of our state's infections are picking up quite a bit. I'm thinking about Arkansas. I'm thinking about Missouri. I'm thinking about Mississippi. I'm thinking about Florida. Arkansas, you're 10 times more likely to be infected than you are here in Connecticut. And it's just a reminder, again, that we have not gotten rid of this pandemic until everybody is safe. And that what happens in New Britain or happens in Arkansas can come back. And that this damn Delta variant is really, really infectious. And that it's just walking around downtown Bristol trying to find somebody who hasn't been vaccinated. And if they can get that person infected, then you got two people walking around trying to get somebody else. And as you've heard from Kurt and the doctors, the good news is the vaccines really, really work. Maybe there's one person with COVID infection. Is that what you said, Doctor? You're here in the hospital now. We're at the lowest rate of COVID infections this state has seen since we could count what COVID infections were. Anybody who isn't hospitalized has generally been somebody who has not been vaccinated. And that's why I work tirelessly, as does Deirdre, as does all the healthcare providers, do everything they can to tell your friend who has a friend how important it is that they do this, especially in those communities which are the most likely to be unvaccinated, most likely to be at risk. Kurt mentioned the 1918 flu. We were looking for information, a year plus ago, and I did, study a lot that that 1918 flu. It was the second wave that hit people the hardest. That did not happen in Connecticut. In Connecticut, we were more likely to be tested. We were more likely to be prepared. So unlike neighboring states, that second wave that hit in, October, November, December did not hit us nearly as hard. But after 1918, there still were flare-ups around the country over the next few years, and a lot of people died. Shame on us. We've got the vaccine. That should never happen in the United States of America, and more broadly, it shouldn't happen in the world. We've got plenty of vaccines right now, and that's what we've got to work on to make sure that everybody gets that opportunity to get that shot. It makes a difference. And so we're trying incentives. And, the incentives have an impact. Drinks on us, that was fun. You don't want to be the 20-year-old stuck picking up the tab with a loser. Now, we've got the rock the shot. And anything we can do to have people talking about vaccines, and anything we do to give young people a little more of a boost to get forward and talk about it with their friends is what we're trying to do. And I think it's going to be a really good summer. And I really think it's going to be a good fall in Connecticut. I think if we can continue the slow progression of people getting vaccinated, I do believe that you're going to get we're going to go to the full FDA approval. I think that's going to be within a month. I think you're going to find that there's 10, 15% of people that are using the emergency use approval as one reason maybe to sit back a little bit. Nonsense. As Deirdre said, not only have we had full FDA testing on this thing, we have hundreds of millions of people who have been vaccinated with Moderna and Pfizer and J&J. We know that this is safe. We know it works, but perhaps that a full FDA approval will help. I think you'll see vaccinations for the youngest demographic, 1 to 12, the only group that doesn't have that opportunity yet. That should be coming along, later in the fall. But in the meantime, I want to make sure that we do everything we can with our friends and with our neighbors and our communities and our friends in Sterling and New Britain to get vaccinated. So with that, we did do a little event where we got somebody who got front row tickets, or darn good tickets anyway, to Luke Bryan. And I just wanted to give him a call or vice versa and congratulate him.
Hello?
Hey, is this Joseph?
This is.
Hey, Joe, this is Ned Lamont. I'm governor of Connecticut, here with just a few of my closest friends from Bristol Hospital and the entire Connecticut press corps. Just want you to relax. But I really wanted to say congratulations. You have won the contest. You're going to Luke Bryan. Do you know about this?
I do. Apparently now I do. It's awesome. Thank you.
You ever heard of Luke Bryan? You know Luke Bryan? You know his best song?
I do. It's something to do with margaritas.
Margaritas, play it again. You're ready to go. I love that. And just tell me, I understand you're about 30. I know you work with your dad there down there in Bridgeport. Hopefully this, rock the shot got people a little more incentive. But tell me about why you got vaccinated and why you got vaccinated now.
Yeah, so we own a family business. We're a stone company down in Bridgeport, on Thrift Stone Concepts, and basically we do, construction work. We do marble and granite countertops and fireplaces and things like that. And, unfortunately, we weren't really able to shut down during the pandemic for much because we were essential workers, and, we had people's home renovations had to keep moving. So, it was, working in a factory, it's kind of close quarters, so it was important for all of us to get our vaccines. And, my father's a high-risk individual, and if I'm going to be working with him every day, I don't want to put him at risk, And, not even just that. Like, I'm not really interested in putting anybody at risk. If I go to the grocery store or, CVS or anything like that, I'm not interested in putting anybody at risk to get sick.
Well, look, thank you. I love that. It would have been easy to say I dig Luke Bryan. That's why I'm doing this. But I like the fact that you said my dad's at risk and some others around me. Perhaps they have some immunocompromised. They can't get vaccinated. You were thinking about them as well when you got vaccinated, and that's the message I want people to hear. Anyway, man.
Absolutely, yeah. I mean, as a 30-year-old person, I wasn't too concerned about myself, but, it's more about other people.
Hey, congratulations. I hope you love the concert. Come see me in the office afterwards and tell me how it went.
Awesome. Sounds good. Thank you so much.
See you, Joe. How's that? Thanks, everybody. Wasn't that fun?
Can I be the first to say this?
Yeah.
So the slogan's got to be rock the shot and you can rock on. All right? How's that?
All right, dude. I'm there. I love it. That's great.
Can you talk a little bit about the variants? I noticed in the daily briefing that you have more cases of that B117 than you do the Delta.
Want to take that?
So in our latest report, I think there were something over 1,100 cases of the B117 variant and only 51 of the Delta. So in Connecticut, Delta is not yet the predominant variant like it is elsewhere in the United States. Why is that? Probably it's because we don't have a lot of virus circulating in Connecticut, thank goodness. And that's because, as the governor said, people are vaccinated. So the more people that are vaccinated, the fewer viral particles are out there replicating in nature, and the less opportunity for these variants to develop and then to become dominant. So the success of people like Joe getting vaccinated for all the right reasons has really, I think, probably helped us not to see that Delta variant take off yet.
And are you hearing that the FDA is going to approve the vaccine for a regular use?
Well, they're very tight-lipped about what they are and aren't going to do. We know that it's under consideration for full approval. I believe it's the Pfizer vaccine that's that's already submitted their application for full approval. Every indication from all we know about the safety and efficacy data is that it should receive full FDA approval and soon, as the governor indicated. But they don't sort of let out breadcrumbs when they're contemplating such important decisions like that.
Yeah, I was just curious about the wheat preference. What wheat preference?
Oh, I don't have any specific information about a date.
Next month, but that's rumor.
What's the I suppose if you're in a community, I was looking at some of the numbers. I mean, you look at, Bristol, surrounding, I think Farmington, the number that I saw, I think was close to 70 or maybe even 80%. Outside of Waterbury, all the towns around it are at least 50%. Some are up to 60%. What's the risk in these communities, in particular in the neighborhoods in these communities, with large unvaccinated populations in terms of any of these variants or any strain of the coronavirus, but perhaps the Delta in particular?
Well, the risk is that if large numbers of people are unvaccinated, are associating that we will see outbreaks and spread. Now, with the level of vaccination that we have as a state, we're not going to see a wave this fall like we saw last fall and last spring. But what the governor and I very much want to prevent is pockets of outbreaks in the fall with potentially a more infectious and more virulent strain of COVID that could lead to more hospitalizations and more deaths. It also could disrupt things like schools, sports that people want to get back to, normal activities, social activities, gatherings, etc. All the things that we have deferred and delayed. To the extent that we're seeing outbreaks and pockets of outbreaks around the state in the fall, that's going to make it that much harder to put COVID behind us and really turn the corner on all of these restrictions that we've seen.
And for both of you, is there any idea of when there might any kind of guidance that you'll be able to provide to school superintendents and school boards regarding masking and other issues and vaccinations, I suppose, for school-age children?
Why are you looking at me?
Yeah, well, I can take it.
I'll start. Look, I think we're going to be okay. But I thought we were out of the woods a month ago before Delta came along, Paul. So I think we're going to have to wait and see just a little bit longer. I'm going to have to, see where the teachers are. If the teachers are 100% vaccinated, feel 100% confidence going back to the school, that's one thing. If they're hesitant because they see things flaring up, we'll have to take a look. I really feel strongly, though, that we're going to have kids in school and we're going to have teachers in school and we're going to be able to do it safely. And I'd like to think that all the high school kids who love Luke Bryant are going to all get vaccinated in the next 60 days so we don't have a discussion about high school.
Do you guys have any way to quantify or evaluate in sort of like a tangible way the success of like Drinks on Us or Rock the Shot or these other incentive programs?
So let me just finish answering that last question on schools. So we're at now about under 50% of kids in Connecticut 12 to 15 who are vaccinated. So we need to really make a push this summer to make sure that families understand the reasons and the importance for getting those young adolescents vaccinated. And we're at 65% of individuals 16 and 17. So we're going to have a large chunk of kids, in addition to those under 12 who won't have a vaccine available to them, we're still going to have a large chunk of kids unvaccinated in the schools in the fall. So that's why we're talking about, as the governor said, keeping the vaccine conversation going to make sure that people know now is the chance to get vaccinated. We don't want to see those disruptions to sports, to prom, to graduation, to all those school events that could happen if there are outbreaks in schools in the fall. We've got federal funding to do more testing in schools in the fall, so we'll be continuing to do that. And we anticipate comprehensive guidance from the CDC on schools any day now. They've been telling us it should be released. And in terms of the effectiveness, I mean, we had 3,000 people enter. We're doing an analysis now to see how many of those people were previously vaccinated and how many people were recently vaccinated as a result. But this is a brand new incentive. So we're talking to you today, and we're hoping that more and more people will enter and learn about the program.
And were these connected? You said some of the future drawings are connected to specific clinics. Were these connected to specific clinics?
No, there's two ways. Thanks for that question. So I can clarify. There's two ways you can get concert tickets. One way is to go online and enter your name, like these 30 individuals who are winners today. And the other way is to show up to the clinic. So tomorrow is Stafford Speedway. There'll be Luke Bryan tickets being given away tomorrow evening at that clinic. All you have to do is be among the first 24 people to get vaccinated at the clinic, and you get free tickets. So all those details are on the website, ct.gov/rocktheshot.
Governor, on Alex's question there, you said Connecticut's got better numbers than Arkansas, et cetera, which is true. What do you attribute the numbers to? I mean, people in Connecticut think they're sophisticated, and maybe they are, and they think that. But what are the reasons, in your mind, in your own words, for Connecticut's numbers?
I think we're smarter. I think we believe the science. I think that we were hit hard early, along with New Jersey and New York. I think that was a real wake-up call. So that meant that we were more likely to listen to the science. That meant we were more likely to get tested, and that shows that we're more likely to get vaccinated. You know, to Alex's thing, along the way, we've had some very targeted incentives that I think moved the dial incrementally.
Where did the Rock the Shot idea come from? What was the inspiration?
We're looking at the demographics of folks that maybe are a little less likely to be vaccinated. You know, young people, maybe kind of country western fans, or you know, rap hip hop fans. Let's put it that way. So we figured maybe we can target this population with the tickets, and some front row seats might get people's interest.
So what role have different incentives in other states have put in? Like Ohio got a lot of publicity for their $1 million drawing. How much have you been looking at what other states are doing?
I've been looking at it a lot. Look, the good news is it got everybody talking about vaccines right when everybody else was going back to the beach saying, "Hey, I'm done." That was good. You look at the numbers on Ohio. It got a little bit of a spike briefly, but also they had opened up to 12 to 15 that week, so I don't quite know what moved it. Our incentives are not as expensive. They're a little more targeted, and I think they're more effective.
Who's paying for the concert tickets? The state?
I think we're splitting that, aren't we, with Live Nation, if I'm not mistaken?
Yeah, federal vaccine funding.
Yeah.
I also have a question for Kurt.
Please.
While we're at it. So the Connecticut Hospital Association has recommended that hospitals mandate vaccinations, and several hospital systems have announced that they're doing so. I'm just wondering where you guys stand on that.
So great question. Thank you. And just before I do that, I just want to introduce Dr. Rich Swag here, who has been on our medical staff for 40 years. He doesn't look a day over 30, but he's been here for 40 years. He's an infectious disease physician who's been here, and he's just amazing for our community to have, especially during the pandemic. And I also see Dr. Kumar back here, who has taken care of our critical care patients. So, and I apologize for taking your question and sidetracking a little bit. So, great question. And as you probably are well aware, the hospitals in Connecticut, one of the most amazing things is we collaborate together and work together on these kind of initiatives. And I think all throughout the pandemic, and I'm actually on the board of the American College of Healthcare Executives. I'm a governor. Actually, I'm a governor as well. And so I participate with, hospital leaders across this country. Connecticut is one of the most collaborative states that I've ever worked in, and I've worked in several others. The question of mandating the vaccine, I think is, for me, it's a personal thing too, right? So if you think about it, we quarantined long-term care facility patients for well over a year, right? They didn't see their loved ones except through windows, and we actually had a horse come and visit patients through a window in our facility here. But guess what happened during the second and third, round of this? People still got COVID and they died. So where did it come from, right? So for me personally, I think it's a commitment to the health and safety of not only each other, but our patients that we get vaccinated. So Bristol Health, along with all the other hospitals in the state of Connecticut, I was part of that vote, voted to mandate the vaccine. Now, the details about that, the Hospital Association, the Connecticut Hospital Association has Patrick Shermell, who's the president and CEO of Griffin Hospital. He chairs that committee. They met this week, had a very, very healthy, lively discussion, and that discussion is around how are we going to, as a state, implement that mandate. Now, for Bristol Health, my personal hope is that we get it done by sometime like September 30th. Remember, of course, that means 2 shots, right? So it takes time. We have communicated to our employees that we are planning to mandate it. And I would say the reception has been really very, very good. We're at about 75%, correct me if I'm wrong back there, guys, about 75% of our employees have now had been fully vaccinated. Some of the same concerns that you heard Commissioner Gifford talk about are the same very concerns that you hear. Imagine, if you will, a population that is dominantly female, so percentage over 90%, is that 87%? 80%. Wow, we've made some progress, haven't we, in diversity? So pregnancy, big issue. Of course, it's a big issue. People are concerned. They need more information. But so, great question. 100% we support this mandate, and the Hospital Association is working vigorously through Patrick Trammell's leadership and the rest of the team's leadership to make it a reality for all hospitals and healthcare in the state of Connecticut.
Yeah, so there was that one situation, and I think it was where dozens or hundreds of people quit their jobs as opposed to getting vaccinated. Do you have any fear among that remaining 25% that you could see that level of pushback here?
Yeah, so great comment, great question. Sure, if everybody isn't on the same page, obviously you're going to have employees that are going to shift from one place to the other. There are parts of Connecticut that border other states where that can be a concern, and I think you heard the governor say repeatedly how advanced we've been. I had the occasion of actually driving through Arkansas in January, relocating my son to the West Coast, and I saw many people not wearing masks. So I think there's more to it than just our sophistication here. But yeah, that is a problem. And again, it is a very collaborative state. And in terms of hospitals and healthcare, we all work together. And that is a fear. If we don't all do it together, there could be a shift in people to other states potentially and between organizations. And right now, it is an incredibly difficult time for us in healthcare. We are short, and you have to imagine, we realize how short we are in some areas, long-term care facilities, for example, and respiratory care, you name it, nurses, every part of it is a shortage right now. It is a concern. It is one of the primary reasons why, as a hospital association, we all work together and collaborate.
Thanks.
Anybody else? I'm sorry, before I sit down. Thank you.
Thanks, everybody.
Thank you. Thank you so much for coming today.
Run before she comes up with a tricky question.
Oh, no.